We'll go ahead and start in a minute. Good afternoon, everyone. Welcome to the third webinar of 2022 in the ACCP Immunology and Transplantation PRN webinar series. Today's webinar is titled Optimizing EPIC, Tips and Tricks from the ACCP IMTR PRN. In a moment, I will begin the presentation, but first, here are a few quick notes. For our audience members, please ensure that your microphone remains muted for the duration of today's presentation. The mute button is located in the lower left-hand corner. If at any point during the presentation you have a question for the speaker, please submit your question by using the chat functionality at the bottom of your screen. Please send your questions directly to the moderator of today's webinar to minimize the possible interruptions. We will take questions at the completion of the presentation as long as we have time. Today's webinar will also be posted on the ACCP IMTR YouTube channel. If you experience any technical difficulties during this webinar that are not fixed by logging out and refreshing your internet connection, please make the moderator aware through the chat functionality. My name is Allie Webb. I am a pharmacotherapy specialist in solid organ transplant at Tampa General Hospital, and it is my pleasure to moderate today. We are honored to have many great speakers with us today. The evolution to the electronic medical record and really EPIC has helped drive progress in our patients, but has also introduced new challenges for users. A wealth of information is available to the user, but really if you know how to find it and use it. And when used to the best of its ability, EPIC can be an incredible asset, especially to the transplant pharmacist. In this webinar, you will hear from various transplant pharmacists to discuss different tips and tricks for using EPIC to its maximum potential throughout the entire transplant process. We are all sharing our own experiences, but are in no way EPIC analysts. I encourage you to reach out to your own IT department for guidance on how to optimize EPIC in your own institution. Without further ado, I will turn it over to our first speaker. Marisa Lee is an abdominal transplant pharmacist at Massachusetts General Hospital, practicing in both the inpatient and outpatient setting.
Thank you, Allie, for that introduction. The pharmacist evaluation has historically been completed at the time of patient listing with the aim of triaging any high-risk medications or serologies relevant to transplant. A clear mechanism for continued review after listing had previously not been established at our institution, given the limited bandwidth of pharmacy services and a large number of waitlisted patients. The use of high-risk medications at the time of transplant can lead to delays in surgery or perioperative complications, including bleeding, drug-drug interactions, impaired wound healing, or a lapse in their important therapy. Additionally, patient-specific serologies may require time-sensitive pharmacologic intervention to prevent recurrent disease. We initiated a quality improvement project back in 2020 with the goal to assess the impact on transplant readiness of early identification of high-risk medications, allergies, and serologies in waitlisted transplant candidates. These reports we created to identify patients on high-risk medications are run monthly by our transplant pharmacy resident. An email is then generated and sent to the transplant coordinators, APPs, and select transplant providers for each organ group, highlighting actionable items that need follow-up before the patient is transplanted. There are a large number of reports that we run to identify high-risk medications, pertinent allergies, or high-risk serologic markers that require pharmaceutical intervention at the time of transplant for our kidney and our liver transplant candidates. These reports include use of medications that can interact with our common transplant regimen, such as certain anti-epileptics, protease inhibitors, and boosters. These also include medications that could increase the risk of surgical complications, such as antiplatelet agents or direct-acting oral anticoagulants and mTOR inhibitors. And those that could impact our decision on induction at the time of transplant, such as age or use of immunotherapy and biologics. These reports are available to anybody with Phoenix access, and they're created from the Phoenix Transplant Episode Waitlist Report. And so if you use the search criteria, the find criteria at the top, you can add different criteria to your reports. And the availability or the pre-populated criteria can vary between centers, but this is what our reports look like. And this is the example DOAC report that I have here on the screen. So the first criteria we have is the episode type. So we include patients that are on the transplant list with an active evaluation. And then we add in the medications that we're looking to include. So for this report being the DOAC specific report, we've included apixaban, dabigatran, rivaroxaban, and edoxaban. And then we include either donors or recipients. And so for the purpose of our reports, we include the recipients only, but it could be something that's run for donors if you're interested. In our center, we run separate reports for each organ group. So this report is specific to kidneys, but you could run it for any organs that you transplant. We also include both active and inactive patients, but place priority on the active patients on the list. And we build a report like this for each medication group that we're looking at and for each organ group. You can also add additional information under the display tab, which is the second tab after criteria, to the report that will then pull into the columns of the Excel sheet that gets generated. And so for the kidney report, we pull in whether they accept kidneys with a higher KDPI over 85% or accept hepatitis C positive kidneys. And for our liver reports, we add in their MELD score, whether they're eligible for exception points, and acceptance of DCD or hepatitis C positive organs. You can also add columns based on the intent of your reports. And after you've added your columns, you run the report, which generates an Excel spreadsheet for your review. The final step of our process is to add a comment to the transplant episode note and EPIC. And these comments are reviewed by our transplant coordinators, and they're also included in the call-in email that is sent to the inpatient team when someone is brought in for a potential transplant. And it draws attention to any medication-related issues that need to be considered before or at the time of their transplant admission. These are example comments that we add to the transplant episode note. So for example, if someone is on a DOAC, we do put a comment that they need to transition to warfarin and that ideally they shouldn't be called in at this time. If they're on dual antiplatelet therapy, we do usually put a comment in about who's approved the use for transplant so that everyone's aware. And then for kidney transplant patients, we include a few specific comments that may impact our choice of induction or affect our interpretation of cross-match results as appropriate. We initiated this project, as I said, in August of 2020. And so in November, we wanted to collect a little bit of data to see how our reports were going. So we included 62 liver transplant candidates that were on high-risk medications or had allergies or pertinent hepatitis B serologies. And we found that the most common medication-related interventions included discontinuation of high-risk medications, changing these medications to preferred therapies, and updating their medication lists with medications that they actually weren't taking anymore. And so we found that the monthly review of our liver transplant candidates via the electronic medical record could allow for real-time review and an intervention prior to transplant. The one major limitation of this process is that it is reliant on the medication list being up to date in Epic. So if somebody sees a lot of outside providers, that's not always possible. But if their medication list is updated in Epic, it should pull the meds into the report. And we have now expanded this process to our other organ groups, and we've received positive feedback from our providers and our care team. So at this time, I'd like to turn it over to Althea. Althea is an abdominal transplant pharmacist at UCSF Medical Center, mainly covering inpatient liver, kidney, and pancreas services, as well as pre-transplant evaluations.
Hi, can you hear me? Okay, sorry about that.
Yep.
Thank you, Marisa. Today I'll be going over some functionalities for sign-out purposes in Epic. So starting off, having sign-out notes in general is important for workflow efficiency. This is especially helpful for centers with multiple cross-covering pharmacists for a service. There are different examples on how to provide sign-out to others, and the focus of my presentation will be functionalities built into Epic. I'll be talking about two functionalities which are not documented as a permanent part of a patient's medical record. These are sticky notes and handoff. Do note that handoff is only for inpatient contexts, and later in my slides, I'll go over examples of how we use sticky notes and handoff for sign-out at UCSF. So let's talk about sticky notes first. Sticky notes can be private or shared. Private sticky notes are only viewable to you as the user. And so it would only be useful for your own reminders rather than a sign out for others. The top yellow figure to the right is what a private sticky note looks like. On the other hand, shared sticky notes can be seen by others. They can either be a shared specialty comment or embedded into a patient summary report. The specialty depends on the login context. For example, if you're logging into a pharmacy department context, then the shared specialty comment will display as pharmacy comments, like the figure to the right with the blue sticky note. And the content of this sticky note can be seen by all other users that also log into the same context. And then there are sticky notes embedded in a patient summary report, which will look like the figure on the bottom here. And this is technically called print group 46541, which is more than one average user needs to know, but I put the technical term here just in case anybody needs it for reference. With that said, sticky notes are great for brief communication, and they provide a good overview of information at a quick glance. Shared sticky notes may be especially advantageous for hybrid pharmacists, as they can be viewed both inpatient and outpatient, which could facilitate transitions of care. And along those lines, the content of these sticky notes will be saved and not deleted, which may be helpful for, say, after a patient is discharged, especially if there's anything notable from a recent admission. Now, one of the limitations to sticky notes, though, is that there are no frills, so no special formatting, and there are character limits. They also can be overwritten by others and show no editing history of what was overwritten or changed. For the sticky notes that are embedded into a report, these can only be edited in a pop-up box, which prevents simultaneous editing while navigating through a patient's chart. And the other limitation of the embedded type of sticky note is that you cannot leave a *** wildcard in them, which makes it hard to use smart phrases or dot phrases that you may want to jump through with F2. As an example of how we use embedded sticky notes at UCSF, we use it for transitions of care or TOC to-do lists to track completed and still needed to be done activities. Some tips would be to avoid using any wildcards and to avoid withholding important information that should be kept in the medical record to provide transparency about certain patient details among the transplant team. Next, I'll go over sign-out function in Epic called handoff. This was designed for sign-out and is unique to a specialty, such as for pharmacists. The sections that show up in handoff can be customized to a specified number of sections, as well as display certain texts or smart phrases by default on every patient. The handoff lives in the sidebar and will only display there, and it can be opened from both the patient list and the storyboard of a patient's chart. In comparison to sticky notes, handoff is great due to its lack of character limits and the ability to use special formatting like making tables or bolding and such. It also tracks history of edits and who made them. And I think one of the best advantages of handoff is that it allows the user to edit in the sidebar while navigating through a patient's chart. You can easily leave the *** wildcards in the handoff and close out of the patient's chart. Having these wildcards help to navigate through sign-out templates and serve as a placeholder to quickly jump back to where you left off if you had to close out of a patient's chart for whatever reason. But as with everything, nothing is perfect. Some users may not like how handoff requires lots of scrolling within a small box to see all of its content. Also, it can only be used inpatient and therefore would not be a good option to sign out information between inpatient and outpatient. So at UCSF, we use handoff for clinical monitoring or reminders, which you can see here on the right. We have a box for a patient summary and another for follow-up. In a bit, I'll talk more about the content that goes into each box. A helpful tip to really maximize efficiency in handoff would be to use smart tools and wildcards to navigate through a sign-out template. So creating tables in the handoff also helps to display certain information in a more organized manner. And because there is no character limit, it can be tempting to add too much to the handoff. So it's important to avoid adding excessive information that can be easily found in the chart. The smart tools that I mentioned earlier in the previous slide are essentially tools or shortcuts for more efficient documentation. There are 4 types of smart tools: smart text, smart phrases, smart links, smart lists. This table breaks down the difference between each one. They're often referred to as jot phrases because of how they're pulled up with a period followed by the name. And here's an example of smart phrases that we use in our handoff for our new kidney transplant recipients. In the patient summary section on the left, we created a template in a smart phrase that pulls some identifying information from the patient's chart to form a one-liner and some wildcards throughout. The wildcards allow free text of various elements like the etiology of patient's kidney disease, patient's presenting reason, past medical history, and dates. On the right side of this slide is what we use in the follow-up section. We subdivided this section into 2 parts, plan and to-dos. The template plan for all of our new recipients will include their CPRA, KDPI, induction plan, and the template to-dos are common clinical reminders for these recipients. As you can see, we essentially narrowed down the design of our template sign-out to the elements common to all of our new recipients, and also what a transplant pharmacist jumping onto service may want to quickly see or know about a patient on one screen. Now, the next 3 slides outline the process that we went through to roll out handoff at UCSF. In the interest of time, I won't go over them, but we'll leave it here for reference. I do want to wrap up with some growing pains that we learned from this process. First off, even if you know that Epic is capable of these functions, sometimes the trickiest part is identifying an Epic analyst that you can get the ball rolling. Also, it's important to keep in mind that there's no perfect solution, and you shouldn't let perfect be the enemy of good. And also, sometimes there's no perfect solution either because of the hard coding of the Epic software. The last thing I'll mention is that with any change, it can be difficult to get everyone on board just due to the nature of culture changes. So that wraps up my section, and now I'll hand it over to Mark to talk more about transitions of care. Mark Mariski is a cardiothoracic transplant pharmacist and transplant PGY2 residency program director at UC San Diego Health.
Thank you, Althea. So I have the pleasure of presenting two topics today, the first of which is transitions of care and EPIC sidebar summary. So just a quick overview of what I'm going to talk about. I'm going to go through our sidebar summary and how we use it, which really consists of three parts. A lot of this will actually overlap with what Althea was talking about in terms of functionality, but the methodology is a lot different. So I think it'll be interesting to see how we have two different centers achieving similar things in a different way. Then I'll get into our transitions of care workflow and the checklist, how we track a lot of this data, and then in our transplant accordion in the second section. So when I'm talking about transitions of care, I think it's good to just present where we stand at UC San Diego in terms of our volume and FTE support. So between our abdominal and cardiothoracic programs, you can see our various volume from last year. And then we currently have 6.9 FTEs between both programs, divided roughly half and half between abdominal and cardiothoracic. That does include 7-day-a-week inpatient coverage. We shrink down to one pharmacist on the weekend that covers all services, and also all our outpatient transplant clinics and a couple days a month at transplant diabetes clinic. And then I just want to take a quick look at our volume changes. This is for cardiothoracic transplant over the last several years. I started back here in 2015, and that gave us 2 FTEs for cardiothoracic. And you can see our volume has quadrupled since then. Our FTEs are up to 3.2 from 2. So I think everyone can relate to that lag in FTE increases behind the volume, which makes talks like these even more important with talking about efficiencies. So I'll jump right into our sidebar summary. So for us, when we click into a patient chart, this is what pops up. And what I'm going to talk about is this sidebar over here, which is very customizable, has a whole slew of features that you could put in here. But the three that we use here at UCSD is the pharmacy follow-up notes, the antimicrobial stewardship review, and then the transitions of care follow-up notes. So starting with the pharmacy follow-up notes, this is our day-to-day clinical checklist. This is where we put things like when we have to assess TACR levels or Vanco PK, really anything that needs the next day's pharmacist to look at, we put it in here. Then we'll also include some pertinent big picture items. And this is what allows us to have a more seamless sign out within EPIC, again, similar to what Althea was talking about. And it does have the downside of requiring manual entry. So I just want to take a look at some examples of how we use it. So here's what it looks like in its simplest form. You can see Cassie was assessing this readmitted kidney transplant and ordered a TACR level. So we have TACR level for tomorrow, the goal, and just a note that the mycophenolate is held. And it obviously can get a lot more complicated. Here's an example of a heart transplant still on their index admission. And we have things like a biopsy scheduled for tomorrow and anticoagulation, cyclo levels, watching renal function, like I said, a Vanc level, other things we have to order, things later in the week, like a thyroid panel, next month decreasing the pred, and then getting into some of those big picture items that we just want to always keep track of, dates for dialysis, when they had a balloon pump, ECMO, they got trached on this date, et cetera. And then at the very bottom, the induction plan we had for this transplant date. So it's really simple, obviously, but it's nice how accessible it is to any pharmacist entering the chart, and it's very visible too with fairly minimal scrolling because it just extends to how much you include. But like I said, it does have that downside. This is all manual entry. So then in similar fashion, we have another section called antimicrobial stewardship or AMS review. This is where we include all our ID related big picture items and also antibiotic, culture history, and throwing in any notes for justification for clinical decisions. And here's just an example of what that might look like for a new transplant. We can throw in their CMV status, so that's always accessible, toxo, reason why this patient's on atovaquone, when they started latent TB treatment, some notes on their fungal infections, pneumonia treatment, and the dates of antibiotics when we treated a UTI. So you could imagine, especially on these longer admissions, when we have a complicated ID history, it's really nice to have this history at your fingertips rather than just going to MAR history or trying to dig through notes. We have all this here, which it's useful as a reminder to yourself, but also when you have multiple people covering on different days, it's really nice. This is a handoff tool. And then before I go into the third part, which is the transitions of care sidebar summary, I just wanted to go through some of the items here at UCSD we do for transitions of care, because I know that differs from center to center. I know everybody has to do a certain number of progress notes for each patient. Here at UCSD, we have our own discharge pharmacy with billers that work closely with our patients. So we notify them of any new transplants and checking on medication coverage. We try to do AMRs on most of our patients if we have the time. We do a lot of time on patient and caregiver education. We've actually, this is a little off topic, we created an Emmy video for 30 minutes that's helped facilitate some of that education. So just another way to increase efficiency, but tracking if patients have watched that video yet. Any REMS, things we have to take care of. Under a collaborative practice agreement, we do order all the discharge medications for all of our primary patients, which can take a lot of time, but it's helpful to have us involved in that. We utilize Med Action Plan for teaching with these patients, customized pill boxes to go along with those Med Action Plans. And then on the day of discharge, we do another teaching session and teach back with the patient to make sure that everything's ready to go for them to go home. So obviously that's a lot of things that could be spread out through days or even weeks during the admission. With several people covering, you want to be able to keep track of all that. So that's why we created this TOC form follow-up notes section. And basically we just made a dot phrase that has a checklist for most of those things to keep track of what's been done and when. So this is what that checklist looks like in its bare bones form. You can see a lot of the things I mentioned, putting our note in, notifying the biller, doing the teaching, the Emmy video that I mentioned, checking on some of the expensive meds, discharge meds, et cetera, et cetera. And this is what it looks like more in use for a patient, where you could see the AMR was done, or attempted anyway. The note was done. If I'm looking at this, I could see the patient hasn't received their education yet. So that's something we'd have to keep an eye on. A lot of notes about medication coverage and insurance barriers. And this is just all nice to keep track of in one place. So just to bring all those three sidebar summary things together, I want to look at a more global view of what that can look like on a patient list. So here's an example of what our patient list looks like for heart transplant. And you could actually bring in those items I mentioned from the sidebar summary into the patient list. So you can see our pharmacy follow-up note here, the TOC follow-up note here. The problem is when you have all this text, I have an 18 patient list and I can see 3 patients here. So one nice feature is you could wrap the text and then see a lot more patients. And then from this view, all I have to do is hover over this and I could see all the pharmacy follow-up notes. I could switch over and then hover over the TOC section. I could see everything we did there. And this is a nice quick way to, if I'm trying to plan my day, I could scan through, you could print it, so have all this printed out, or you could just hover over everything and prioritize the day from there. So again, just a quick way to bring all that stuff together. So switching gears into tracking what we actually do from a transitions of care standpoint and having data to track what we do. This is what our heart failure pharmacist group made. It's a simple flow sheet where you can just click through certain things and then they're captured with it in Epic and you can pull reports about things you did. So if we have a new transplant going home on the day of discharge, whoever the pharmacist is doing that discharge, they pull this up and you just do it all in one shot. So I would mark that we did the AMR, DMR, the final education. You could always add other things. This is probably a little more complex than we use on the transplant side. We're really trying to capture just the big picture things of numbers and quantity of patients we're tracking. And then just an example of the type of data that can translate into later. We're not going to go into the actual data, but this is just different pharmacists and different months on how many AMRs each person did. Same thing with discharge medrecs and the discharge education or counseling. We have a flow sheet. This is cardiothoracic by month of how many discharge medrecs. I mentioned we do all the ordering under collaborative practice agreement. So it's important to document something that takes up that much time. You could see over the course of these 6 months, it was roughly 3 to 5 discharge medrecs per day. So this stuff is really useful. I mean, we're utilizing a lot of this data right now in terms of seeking more FTE support and different approvals for that. So obviously everyone goes to their transplant volume, but I think it's probably more useful to have this hard data of what we're actually doing as a pharmacist group instead of just saying, hey, volume's increasing, we need more help. So now onto my second section, which will be a little quicker. I'm going to talk about Epic flow sheets or accordions. I think I think everyone that has Epic has some kind of access to customize flow sheets or accordions, really just a way to, in one screen, look at a lot of information without too many clicks. Here's an example of what a glucose flow sheet looks like here at UCSD, where you can monitor someone's glycemic control. We have similar thing for analgesia and sedation. Other examples are ICU flow sheets, anticoagulation flow sheets. We have pain flow sheets. There's a lot of different ones. So several years ago, we realized how useful these were, and we said we need one for transplant too. And that's what led to the advent of our inpatient transplant flow sheet, which has been super useful since it started. I'll get into the different parts of this, but before I do that, I just wanted to go through what our process before the flow sheet was to assess a tacro level, and just the number of clicks that it entails, really. So going to the results review, either scrolling down or clicking on med levels to see the tacro level for the day, and that's assuming it's resulted. And then going into the MAR history, scrolling or finding, and that could take a little while, especially for the longer admission patients. I'm sure a lot of you know, checking on the doses and administration times of the tacro to ensure it's appropriately timed. And that doesn't even include any other interacting meds. If they're on other immunosuppression, like an mTOR, you have to do the same thing over again. Any anti-infectives or other pertinent labs. So I think everybody could probably relate to this cartoon. I hear there's a new ICD code for carpal tunnel syndrome caused by clicking too many times in the EMR system. So there's my cheesy cartoon for the presentation. But anyway, this transplant flow sheet obviously doesn't solve that, but it has been super helpful. So with again, this is the big picture view of our flow sheet. I'm going to zoom in on the different parts, but doing that same workflow with the flow sheet, you can see how much easier it is. So this is just zooming in on the immunosuppression part of it, with the most recent information being on the right. We have our drugs, our level. So if I pull this flow sheet up, that's one click, I hover over the level, see it was drawn at 6 a.m. Then I can hover over last night's dose. It was given a little late at 9 p.m. with a nurse comment in there. Check on this morning's dose to make sure it was drawn after the level. I could see the whole trend back to what the levels and the doses have been doing. And just like that, I've already assessed that with one click, which took, I didn't count, but obviously several clicks before. And within that same flow sheet, you have anti-infectives, which will be appropriate to look at, obviously interacting meds, other pertinent labs. Again, this is all in one place. So it does save a lot of time. And I'm told from our informatics pharmacists, I mean, it's above my head to know how to design these, but it's actually pretty easy from what they tell me. It's a matter of getting together with your group and deciding which labs and which medication groups are important to include, and then figure out how you want to customize it as a group. And it's just pretty easy to make, just like all the other flow sheets that we have in Epic. So that's all from me, and I'll hand it over now to Tiffany Kaiser. And she's an associate professor of medicine at the University of Cincinnati. She practices as a transplant clinical pharmacist and serves as the director of transplant quality program, and is the assistant director of the PGY2 transplant residency program.
Good afternoon, everyone. Hello from Cincinnati. As Ali mentioned, I'm by no means an Epic expert. I'm here today to kind of share and highlight some of the ways we use, or I use, Synopsys within my ambulatory practice. I know we can all appreciate that our patients have a ton of data, right? And to me and to all of us, I think the data is most useful if we can visualize it quickly and really draw meaningful conclusions. This can be accomplished via the Epic Synopsys, which the synopsis is really just a summary display of patient data. It's condensed all into one screen, similar to kind of the flow sheets that we just heard about. The benefit is that the user doesn't have to toggle between different tabs within the charts. You can customize it so all the data you want to see is right there. For this, thinking about it in an outpatient setting, the data is organized into intervals of time. By default, it's 1 month. However, you can quickly adjust this interval if you want to, depending on what amount of data you want to review. The data are organized in categories into folders. So you see here, there's vitals, hepatic, chemistry, and a ton of options to choose from. Again, the key here for the synopsis is that you're customizing what you want to see. As we've heard from the prior speakers, customization, so it works for your team, is very important. And you want to make it so it meets the needs of your program. So as an example, for our liver program, we customized the synopsis to include medication and drug level information only for immunosuppressant therapies. No other drugs are included within our synopsis. In addition to using a synopsis to summarize some of your standard patient data, you could also use it to do other things, such as to display vital sign data this was an example from a clinical trial utilizing mobile health technology. So we had this for each patient enrolled into the trial. Additionally, the synopsis allows for user personalization. So of course, like all in Epic, other things in Epic, you can change your font size, you can decide what data to review in terms of a graphic presentation. But here you're also able to customize for the individual patient through the patient spotlight. So in this example, there's no data to display in the patient spotlight, but let's consider a situation if you're following a patient that's recovering from rejection, for example. You may want to spotlight certain data for this individual patient. And to do this, you would just click on the push pin for each of the data field you want to track, and then whatever you've pinned will be added to their spotlight as shown here. So then when you go into their chart, you open their synopsis and their customized or data that you want to look at is in their spotlight. So that was just a super quick review of synopsis in case anybody's not familiar. Now I'm just going to go through a few examples to kind of highlight what I think are some benefits of using this in the ambulatory setting. As we've seen and talked about, tracking data over time is why we want to use things like this. So let's just think of blood pressure. So if I saw a patient on March 8th, their blood pressure is 132/75, I can look back in time. Some patients you see frequently, others maybe not. So this is just a 3-month snapshot, as that's what I set it for, of blood pressure. You can also think of the example of you're seeing a patient on their very first post-transplant clinic visit. So this patient was discharged from the hospital about 10 days ago. So on this visit, I see their blood pressure is 139/71. Of course, my first thought and what I want is, how has your blood pressure been at home? Well, as we all experience, the patient doesn't know, didn't bring in their logs, so we have nothing to really compare this to. One thing that's nice about the synopsis is you can, again, go back in time, but look within the same screen to the inpatient data. So as we saw before with flow sheets, inpatient with multiple data values per day, here it's just summarized in a date entry, but you can click on the red plus sign and expand it to see all that data from that day. You can compare it to your outpatient reading and so forth. So it doesn't make up for the patient not bringing information to allow you to assess at home, but you're able within the outpatient look to go back to inpatient and see. As with blood pressure, you can also track immunosuppression. This, of course, is great for all of us. You can look at the details of the medications, and in our case, we just have immunosuppressants here. So I can look at the type of therapy, the dose, frequency of administration, and as well as the corresponding drug levels over time. The very big, huge key to realize and to understand is that in order to successfully use the synopsis, you have to make sure your team's process to capture and document the data within the patient's chart is standardized, right? Everybody has to do it the same way. You can imagine the inaccuracies of trying to use the data if they don't do it the same way. So for us, we make the adjustment within the medical record on the date the change was communicated to the patient. It doesn't matter the way or the mechanism it was communicated. So if it's in person, if it's over the telephone, if it's through an Epic message, the date the change was communicated to the patient is the date that we have. So therefore, when we're taking and looking at the data, we understand because everybody's doing it standard. Expanding on this, I use it, and it's a great tool to really evaluate the impact of all these adjustments to immunosuppression on graft function over the time period. Again, this example just has the 1 month up here, but you can set this for 1 year, 3 years. So for patients further after transplant, if you're seeing them every 6 months, you can still pull a lot of data into one snapshot. So here I can look at the med detail, and then I can compare that with graft function, and I can add in other data points. And again, this is designed based on what you want to look at. It's also super easy and quick to answer questions that you get from your team about immunosuppression, right? They always want to ask you, well, what is this and what is that? Well, you can take this snapshot within the synopsis and really kind of guess or use the data to help you make an educated guess as to what would happen if you made a certain adjustment. Another way I use the synopsis, and I think is hugely important for all of us, is to be more efficient, right? How can we best use our time. This is just one example. I think helps explain it. I was seeing a patient a few months ago, and it was their 12-month or 1 year post-transplant follow-up visit. I went over their medications with them, and they tell me they're taking valganciclovir 450 milligrams daily. This wasn't on their med list. It wasn't in what I had pre-reviewed for the patient, so I wasn't expecting it. I asked the patient to try to find out, what was going on. I said, have you been on this? How long have you been on it? They don't remember. Were you always on 450 milligrams? Were you on a different dose? They don't remember. So, you're trying to find all of this and you can't. You just know that now they're on it. You didn't think they were. So I quickly do a search. I go back to the last time a pharmacy team member saw the patient, and it was 3 months ago, or at their 9-month visit. And at that visit, they weren't on valganciclovir. So now what I'm going to do is say, okay, what happened over the past 3 months? Historically, I always would go to a chart review. Well, as we know, going through 3 months of data can take a lot of time, and especially if the patient has a lot going on. Now I don't do that. I use the synopsis. By checking the synopsis, I'm able to quickly review their data. And here I found that their I went to their CMV viral loads. I was able to quickly identify a timeline as to when they developed viremia. I was able to observe changes in the viral load over time. I was able to look at these levels in comparison with their renal function, their blood counts, as well as adjustments to immunosuppressants. So I was able to get a quick summary and then use that information to go do a focus chart review, go to those specific dates, and was able to identify when the dose or when the drug was started and dose adjustments along their course. And finally, just a few examples to demonstrate that the synopsis is a fantastic tool for projects. There's so many projects, and I'm hoping you can think by the examples I've given how this could help you, but it provides a great location in the chart if you're going to report new types of data. So we added some frailty assessments on the pre-side, so we were able to put them here. It's also a central location. Your whole team knows where to look. It also can help in a performance improvement setting if you're trying to improve your practice. So for example, our lab made a change in their quantification method. We were able to add that here. So when you're looking at someone over time, if you're going a year back, you were able to see tacrolimus as quantified by the various methods. Lastly, I would like to just leave you with a few keys to success with synopsis. As we've heard with some of the other speakers, to get started, you have to partner with Epic, and it's not just partnering, it's finding somebody that can help, somebody that's willing to help. It's key. As I said, we're not the experts. You don't even know some of the functionalities that these different applications can do, but they can help you. You want to customize it to fit your program needs. You want to be sure it's very important to spend the time, engage the team, standardize. Again, how do you put the data in? If it's not standard, it's not going to make sense to pull it out. And as we've heard, a culture change is necessary in order to make it successful. You want to be sure to personalize it within your own workflow, use it to improve efficiencies. I didn't mention this yet, but I think a huge way to be successful with it is to use it as an opportunity to engage and educate. When I have somebody on my team asking me a question about, a certain immunosuppressant dose or changing the dose, I pull up the synopsis, I step through it with them. When they see how I use it as a tool, it wants them to now use it and understand how to use it. I've also used it to highlight and show some of this to the patients. It's in one screen, and it can be helpful when you're in the room with them. And finally, sorry, my button messed up because I saw the message from Allie. Continuous maintenance is a must. So with anything, you build it, you have to go back to it and keep it up to date. If not, it's not going to work effectively, and therefore it's going to diminish its success. I want to thank everybody for their attention. Good luck with using the synopsis. I hope you can find some ways to adapt and bring it into your workflow to help you be more efficient in what you do. At this time, I would like to introduce our final speaker for the webinar, and Nicholas Lang is going to join, and he is a clinical pharmacist manager with the Kidney Pancreas Transplant Program at New York Presbyterian Hospital, Columbia University Irving Medical Center. Nick?
Thanks, Tiffany. Everyone hear me okay? Awesome. All right. Good afternoon, everyone. So I'm going to conclude our webinar today. Make sure I can advance our slides. Perfect. So I'm going to walk us through a little bit about what Slicer Dicer is and illustrate a few ways in which I've used it at my center to help answer questions about how and where and when we're using drugs. As others have, I should preface that, this isn't an entirely comprehensive review of what this tool is, and of course that there's no substitute for practice or collaborating with your institution's analysts and super users. They really are the experts with all of this. So essentially, Slicer Dicer is a tool that allows you to query historical data in Epic. Slicer Dicer may not necessarily be the only way in which you can query whatever data it is that you're looking for. Sometimes the reports like those that Marisa shared at the beginning of our presentation may in fact be more appropriate. But I like how user-friendly Slicer Dicer is, and that I can generate for myself different types of data exports and figures to fit whatever my needs are. And over these next few slides, we're going to explore this tool a little bit further. And for those who are sitting at a computer with Epic open in front of them, I would invite you to follow along here. Now, from the home screen in Epic, you should be able to navigate to Slicer Dicer either if you find the drop-down menu in the top left corner, or if you don't see it there, if you search instead over the little magnifying glass in the top right-hand corner. If you just search by Slicer Dicer, you should be able to find it and open the tool. And it's going to bring you to this screen right here, at which point you're going to be prompted to select one of these data models. Now, for most of my intents and purposes as a transplant pharmacist, I'm normally selecting either medication administrations, which is the one that I've circled on the left, or inpatient, which is what IP stands for, their pharmacy medication orders. And for those who are following along, you can click on either if you see those in front of you, and we'll keep moving forward here. Now, once you've selected one of these data models, it's time to start telling Epic kind of what specifically it is you want to look at. And for illustrative purposes here, we're going to look at some of our institutional belatacept use. Something to note here when you're selecting among the various medication entries that are going to become visible when you search for something is that you'll generally want to select the component simple generic name option that appears there, the one that I've circled, unless you specifically want to look at like a particular formulation of whatever drug it is you're querying. For example, if you're looking to only look at intravenous tacrolimus use at your institution as compared to other PO orders or administration. Now, once you've got your drug selected, you may also want to further whittle down what you're looking at based on, for example, the location or the department in which the medication was ordered or administered. So these two images here are a couple more examples. On the left, what I would be building is a report of all of our inpatient belatacept orders in our adult hospital at Columbia, whereas on the right, I would be building instead a report looking at all belatacept orders in our ambulatory transplant infusion suite. And so if you're clicking along with me here, you can kind of search for whatever specific areas are of interest based on whatever report you're building for yourself. Now, you may also potentially want to subdivide your data a little bit farther to see maybe trends over time or review only a specific period of time. And so within those options there that you'll see on the right-hand side in the dates field, you can tell Slicer Dicer what it is exactly that you'd like to see. So here in this example, what I've instructed Slicer Dicer to do is to show me the total number of belatacept orders over a specific 6-month period, broken down by month, specifically in our ambulatory transplant infusion suite. Just going to pause here for a second, just so that people have a moment to kind of click around and kind of stay with me here if they're trying to play with this. All right, so let's move over to slices. Yes, this is a New York City joke. So what you'll see here within those kind of sections to the right previously was one of the sections was called slices. So you'll want to click on the big green plus line next plus sign next to the slices. And that's going to open a window that looks something like this, in which you'll have a variety of different instructions or options that you can essentially ask Epic to change the way in which you're viewing the data. For example, you can look specifically at medication administration by day of the week, by hour of the day, by patient age, by the way in which the order was placed. You know, was it within a therapy plan or was it a standalone med entry? There's a ton of possibilities, so I'd encourage you to just kind of play around with it. But the next few slides, I've kind of put together a few examples of things that you might potentially do with the slice functionality. So here, what we're looking at are our institutional belatacept infusions based on the day of the week in our ambulatory transplant infusion suite, again, over whatever this kind of specified 6-month period of time is. Here, we're looking at belatacept orderers and order verifiers using this cool functionality called the Grab Top 10, which is available within Slicer or the Slices section as well. And then here, we're looking at belatacept orders that are within a defined milligram range that I've specified. If you can see in those tiny, tiny little numbers at the far hand right, are kind of around but slightly north of 500 milligrams. Now, a disclaimer, we don't do this dose rounding at Columbia. We follow the package insert recs. But if you were looking at some other medication, for example, and you were looking for some dose rounding opportunities, then Slicer Dicer might help you find those. And then the last thing that I'll share here that's important to note is that, in addition to creating all these nice tables and figures within Slicer Dicer, you can also export this data. So what you need to do to accomplish this is, among those kind of options that you'll see on the right, is change the visual options, whatever the default section is for you, to the detail table, which is the one that's selected on the screen here. And then just simply expand the data by clicking on the little down arrow and right click to export it. And generally, whenever I do this, I have to save it normally to like my own H drive within the hospital's system in a password protected format. So that wraps up my 101 overview of Slicer Dicer. And at this point, I'll now turn it back over to Ali.
Thanks. Yes, we do have some questions in the chat, so we'll try and get to as many as we can before time runs out. But just as a reminder, the slides will be posted to the ACCP IMTR YouTube page shortly, so you should be able to rewatch the video through the YouTube page. Hopefully throughout this video, you got some good tips and tricks to take back to your institution. And I also have the presenters' emails on the next slide, so we have those available. If you have any questions to follow up later, feel free to shoot them an individual email. So first question is for Tiffany. The question is, does Synopsys pull immunosuppression data from the prescription or med list, or is it manually entered?
Good question. It pulls it from the med list. So again, that's why it's important to standardize how your team updates and changes and modifies it so it reflects accurately.
Perfect. Another question for Tiffany is, how do you get the tacrolimus dosing to display correctly in Synopsys? We've had difficulty with doses that use different strengths or different AM and PM dose.
Again, I don't know if I could say it's correctly how it displays. It's just to try to make it standard. So, most of the time, if we have two strengths, so you're on 7 milligrams, you have a 5 milligram and a 1 milligram, it would display like that. And then in the text, the team would write, take this and this for a combination of 7. So then you see both strengths and you have to hover over it so you can really understand. If it's 6 in the morning and 7 in the evening, you would do the same thing. It's just a standard approach, so it's always the same.
Thank you. This question is kind of for everyone, so anyone who wants to unmute and speak up. This person is going to be transitioning to Epic within the next 2 years, so starting to prepare for that transition. Any suggestions for them on how to work with their IT group or requesting IT support for those who have done a lot of work with Epic IT, or any barriers that you may have encountered or things you wish you knew going through that transition?
That's a tough question. It's been a while. I can't even think of how many years. I think in the beginning, there are people within your team that are working with Epic to get it started. I think understanding what some of the primary or high level dues are makes sense because if you come up with a whole bunch of extra things, you're not really going to get any feedback from them. But to try to get involved and work with the group that's moving and adding things as you're opening, I think is important to get your kind of request or interest high on that to-do list would be my suggestion.
At UCSD, we're really lucky to have informatics pharmacists that help us with this stuff. One thing I would add, though, is that if you do have that option, to ask them if they offer rotations for the residents, because when our transplant resident takes the informatics rotation, it's just absurd how much gets done. We just keep a running list of all the little projects we need to get done, and we get a lot done within Epic that way.
That is a great suggestion.
One other thing I would add is in the setting of kind of thinking about things that you want to build, try to envision the end product and work with the Epic analysts to understand how to best get that build up front so that you limit the number of like revisions and iterative redos and kind of the way in which scope creep can subsequently kind of burden your Epic analysts and super users. So I think the more work and thought that goes into things on the front end, the easier it is to have a good product that's usable when all is said and done.
This next question is for you, Nick. Can you use Slicer Dicer to get the list of patients given a certain drug in a certain time frame instead of just number of patients and number of doses?
Yeah, so you can. So if you want a list of patients instead of just the number, what you would do is, for example, if we were using our belatacept example, where we wanted our defined 6-month period or 1 month or whatever it is, at the data, the visual options, which is one of the last sections after slices and dates, you should be able to change it to a detailed list. It'll then show you, that in that 6-month period, there was 1,200 belatacept orders or whatever it is. And you should have a little drop-down arrow that you can click to expand it, which will give you every single instance of belatacept ordering. And you can add data columns to that report that would include patient name, MRN, and then subsequently export that to do whatever you need to do, in addition to quantifying sums in weeks, months, etc.
Perfect.
And if anyone needs help with that, just shoot me an email and I'll see if I can try to kind of walk you through it.
Thanks, Nick. So this question is also for everyone. So the question is, I think most transplant centers use a non-Epic program to customize discharge med lists, such as using Word or Med Action Plan. Does anyone have a good way to make the discharge med list more customizable and user-friendly within Epic?
I can speak to what we do at NYP, both at the Cornell and Columbia campus. We use some medication list that comes from the medical record instead of using something like Med Action Plan or a Word document, because those don't interface with the medical record easily and it requires a lot of legwork to keep them maintained. Some of the transplant programs will use the medication list that's available through chart review. It's just kind of a miscellaneous report that generates after someone does the discharge med reconciliation. But there's also this really cool, nice view of med lists within the summary tab that I go to and use a lot. It's nice in that its format is very similar to Med Action Plan, where there's actually a grid for morning, afternoon, evening, bedtime meds, and you can put check marks and comments within each particular medication. And this is nice because it's kind of patient friendly in that it's similar to what I think a lot of people have experienced with Med Action Plan before, but it's also, you know, integrated within the medical record and doesn't require any kind of extra work to keep it maintained.
Also, Med Action Plan does have the ability to embed within Epic. It's more expensive. It does have some challenges that go with it. We were one of the earlier centers to set it up, but now that we have it running, it's really nice. So medication change pretty much automatically gets updated into Med Action Plan, and you open it up within Epic.
Awesome. Do any of the pharmacists document within the transplant checklist? And if so, what information has been helpful to include in the checklist? No, no one uses checklists, sorry. Someone has a comment. At UWMC, we have also switched to using Epic MedList. We generate these under the discharge tab for inpatient encounters, and the activity is called medication detail. Thank you, Evan. Yes, we started doing that a little bit too at Tampa General, the medication detail, so that can be helpful as well. Question for Tiffany. Within the synopsis, when you have labs, are you able to add any comments? So for example, if a patient gets a tacrolimus level and it's drawn inaccurately, are you able to make note of that at all so that that is taken into consideration when you look at the data?
I'm not aware that you can add your own note within the synopsis, because the synopsis, once it's built, is going to view for all users as they open it. So you could use your sticky note or something like that. However, I didn't really give an example, but at the top where you have the date, you can click and also see the time. So sometimes just that quick look is reminding you that the time was off, you know, if you know where the patient is. It seems to me with Epic, there might be a way to put your own notes, but I'm just not sure that they stay in there permanently, as the synopsis, like I said, would look the same per user that opens it with the data that it populates with.
Okay, makes sense. And that is all the questions we have in the chat. So as I mentioned, if you have any questions specific to any pharmacist, feel free to shoot them an email. Thank you everyone for joining today, and have a great rest of your day.
Thanks, everyone.